So welcome to the SuperMed Ultra software. Today I'm going to do a quick demo showing a few parts of the software for now. Um, I'm logged in as a receptionist or a nurse that is at the reception. So once you click on records and reception, you have options like register a new patient. You can view the list of patients and then you can book a consultation. So if you want to register a new patient, you click on this, you would get the normal form where we enter the name, the phone number, the last name, the gender, the date of birth, and everything here. I'm not going to register a patient now because I have a few some dummy patients on the system. So I'm just going to hit on the logo to come back here, and then that's the list of patients. So let's book a consultation and see. So once we click on book a consultation, we'll be brought to this page where we select the patient's name. That's a patient that's been registered already. So I'm going to pick test for Ghana. That's the name I gave my patient. And then be able to pick whether it's cash, national health insurance, or corporate insurance. So we select one of them. In this case, I'll use cash. If you select insurance, you have to select the insurance company and the insurance package. So the registration and consultation types, we have the option here. So we'll select maybe general consultation or OPD consultation or whichever consultations that have been added to the system. In this case, I'll choose OPD consultation and the price is put there 500. So with this, I can just click on save and I've booked a consultation for the patient called Test for Ghana. So that's the booking of the consultation. I'll have to log in as a nurse to enter the vitals, and then we can assign the patient to a doctor. So I'm going to log out and log in as a nurse, and then we'll see about that. So I'm logged in now as a nurse, and I have the option to click on nurse's workspace to come here. Um, I can enter vitals for consultation, and then there will be a few other links here once I'm done. Like the nurses should be able to enter the nurses' notes. They should be able to read doctors' review notes for patients on admission and stuff like that. This is just a quick demo of the first prototype. So we have enter vitals for consultation. So once you click on that, you would have the patients that have been registered for that day on the system. So I'll click on the name of the patient, which was test for Ghana. Yeah, that's how I named the patient. And then the nurse has the interface to they can basically view the consultation the patient was booked for, and then they can enter the vital. So once it says add row, we have the option to add maybe the temperature, the pulse, the systolic BP, the diastolic BP, the respiratory rate, maybe 20. And then the nurse saves. So once the nurse has saved, now I'm going to log in as a doctor. Let me log out and log in as a doctor and show you the doctor's interface. Okay, so I'm logged in as a doctor now, and I can see the link to view current consultations. If I click on it, it shows me the consultations that have been booked for today. So I'm choosing the first patient that was test for Ghana, and it's a cash patient, and the patient can be assigned to a particular doctor. So that's what's here. Now, when we get to complaints, you can do the list of complaints as some doctors don't want to type much. So you can select fever, then maybe chest pain, and then maybe headache. So now you have these selected. If you don't want any of them, you can just click and cancel them out. And once you have done with that, that's fine. Or else you can also decide to type if you want to type. So the first option is with a list of complaints. If you don't want to type, you can just select the complaints here. If you want to type the whole history, you can type it here. Then you can view the patient's vital signs, see the nurse's notes, and then as a doctor on the ward, you can add your reviews and then write your prescriptions. This here, and then procedures. So there's one here for suturing. Let me see if I can add another one like cesarean section. And as you can see, once I select it, the price in the system is shown here. I'm unable to edit. You don't edit here. The price is already inputted in the system, so you get it here automatically. So I can select an x-ray. We have chest x-ray here. I can add another one like pelvic scan. So that's 50 Ghana cedis, or depending on the settings for your country, will have your currency. So that's it here. And then you can write your case summary, especially for cases on the ward, and then you save. So with this, now I will log in as a cashier, and then we'll let the patient make the payments for us to see. Thank you. So I'm logged in as a cashier now. As the cashier's workspace is here. If I click on bill payments, it will show me the bills for patients for the current day. If somebody came some weeks ago and they want to check their bill, I could always use the date filter to find out which dates they came, and then I'll pull their data out. So here we have a patient, the test patient again. If I click on it, it's supposed to display the bill for that patient. Remember, we booked an OPD consultation for the patient. We also requested for an X-ray, and then we also did a suture. So the consultation was 500, the X-ray was 200, the suturing was 700. So the total bill is there, but in this case, for a patient in our system, we let them pay individually. If they want to pay all, we take the pay separately because each payment is logged into the department that generated the invoice, and it helps us to track and know which department is doing well and which department is not doing well and stuff like that. So I'll click on take payment, and then that's it. So in this our system, the cashier does not enter an amount. They just click on take payment and the system just does it. Previously, if you look at the old SuperMed, the cashier has to enter the amount and stuff like that. But this one we just disabled it, so you can take the exact payment and give your change back to the patient. So it's generating a receipt. I'll not wait for that. And we can change the receipt formats every time. So the payment has been done, and as you can see, it's now reflecting as paid instead of pending. So I can take another payment again for the 200 to ask me to confirm, and then it processes it. It's generating a receipt so that we can print it. Let's leave it. We'll come back and look at the receipt. And then you can take the last payment as well for a procedure. The reason why we have the payments being done per the department, depending on the department, like radiology, consultations, procedures, and everything, is to help us in case a patient cannot pay everything at once. They can pay what is more essential for that period, and then maybe come back the next day to pay for other pending um, requests on the system. Okay, so this is just an overview of the SuperMed Ultra. If you want to print out the receipt, then you just print out the receipt. There are other things I will be showing you, that like the lab section and other areas that are in the system. There's also the system. This one comes with a full accounting module, so you can have all your accounting and taxation and everything being worked out on the system without having to do any manual work. There's also other features like the HR section, which we are given for free. The accounting is there. The laboratory, the LIS, the laboratory information system is also in there, and so many others. I haven't put all on the interface yet, but I've coded them already. So we just have to put them in the interface so that you know where to click and go. Thank you so much.